Welcome, everybody, to another one of our series on artificial intelligence. My name is Roberto V, and this is the webinar on how to assess trustworthy AI in practice. Welcome to everybody from all around the world. I know we have people here in Europe, in North America, in Africa, and in Asia, and in the Middle East. So it is a truly global event, and we're delighted to have you here. I wanted to recognize all of our supporting organizations, the International Society for Professional Innovation Management, the special interest group that they have on digital disruption and transformation, Carleton University, the Sprott School of Business, and the Center for Cross-Border Digital and Inclusive Entrepreneurship, as well as the Technology Innovation Management Program. It is great to have all the support from different organizations, and so thank you so much for making this a reality. So today, from me, you're going to hear very little. I'm going to pass you over to our host, and then I'll come back to you as well and be monitoring the chat and the Q&A section for this. So we'll do a quick little introduction of who our host and our guest speaker are, and then we'll have the main presentation, and then we'll follow it up with a Q&A. So it is my pleasure to introduce Dr. Stoyan Tanev. Dr. Tanev is an associate professor and director of the Technology Innovation Management Program at Carleton University here in Ottawa, Canada. As an expert in the field of value creation, business analytics, and digital business transformation strategies, Dr. Tanev has dedicated his career to helping companies stay ahead of the curve. He is a leader of the special interest group on digital disruption and transformation of the International Society for Professional Innovation Management, which is ISPIM, and has previously served as the editor-in-chief of the Technology Innovation Management Review. Dr. Tanev has recently co-edited the book Artificial Intelligence and Innovation Management, which provides a deep dive into the intersection of these two important fields. Today, Dr. Tanev will be introducing us to our main speaker, Dr. Roberto V. Zicari, who we are delighted to have as our subject matter expert today. With his extensive background and experience, Dr. Tanev is the perfect person to set the stage and later discuss with us the insights and ideas that will be shared by our main speaker. So, without further ado, please join me in welcoming Dr. Stoyan Tanev to the stage, to the virtual stage. Dr. Tanev, over to you.
Thank you. Okay. I'll start with the slides. Okay, welcome. Thank you, Eduardo, for your nice introduction. As you mentioned, this is a second round of our webinars. We had one a year ago, and we continue with the same topic related to AI trustworthiness, ethics, and related issues in practice. And in practice is a key word here. So why another webinar? There are so many, and we were sometimes overwhelmed with so many that are offered. But you know, for me, there are a couple of questions that drive the reasons behind this webinar, and it's about who cares. In the Technology Innovation Management Program, I learned to ask the question, who cares about, specifically in this case, trustworthiness of AI systems. You know, yesterday I asked ChatGPT, who cares? And ChatGPT gave me a list of stakeholders that potentially care. I said, do they care enough? And ChatGPT offered me 5-6 reasons why those people should care. And then I said, well, that's nice. So there is a point of doing this. And then I said, well, but ChatGPT is an AI system. So what makes me trust this particular system? So the question is, you know, how do we recognize a trustworthy AI system when we see one? Are we careful enough to develop a methodology to learn the ways of evaluating, assessing if such systems are being trustworthy or not? So this brings me about to the issue of care, something that I learned from a dear friend of mine, Craig Bremner. who always talked about the ecology of care in the technology world, in the world around us. And he gave me this quote this morning, early morning. Indicators are natural everywhere, part of everyone's life. Indicators arise from values. We measure what we care about, and they create values because we care about what we measure, the Tonella methods. So we are trying to come up with those ways of measuring trustworthiness that will make us, progress with the booming spread of AI in our lives. So who cares? Just wanted to mention that the key organizations behind this webinar. This is the International Society for Professional Innovation Management, a world organization that puts together innovators, scholars, practitioners, companies from the world. It has several conferences during the year. The next one is in June in Ljubljana, in 4th to 7th of June. There is another in December in Salzburg. It's an European-driven conference, but with multiple satellites in North America, Middle East, Japan, Australia, and so on. Part of this international society is a special interest group on digital disruption and transformation. This is the key organizer of this webinar, together with the Technology Innovation Management Program at Carleton University. This is a group of people from Sweden, Denmark, Germany, Switzerland, Canada now. So those are people that try to shape activities within the society that will make people get engaged with issues related to the disruption and transformation. We also have our site, the Carleton University, the Sprott School of Business, and the Technology Innovation Management Program. As I mentioned, the Technology Innovation Management Program is celebrating the 30th year anniversary from its founding in 1993. It's a program for professionals with minimum 2 years experience, with multiple degrees related to the topic, which is the Masters of Engineering, Business Analytics, and the new Masters of Digital Transformation and Entrepreneurship, which is coming in September, something that we're very much excited about and something that relates deeply to the topic today. So who else cares? Well, our speaker. We have Professor Roberto Zicari, and when I read his bio, it inspires me to think that there are people like that have made their career a purpose, their purpose-driven career. He has been on different places around the world, from Berkeley to Seoul to Finland, and he is the leader of this international group. He has founded the international group focusing on the assessment of trustworthiness of AI system called Z-Inspection. He's formerly affiliated with the Arcada University of Applied Sciences in Helsinki, Finland, and also adjunct professor at the Seoul National University in South Korea. He's on good sense of the technology side of things. He's a professor of database and information systems at the Goethe University of Frankfurt, and also internationally recognized expert in the field of databases and big data. He's the editor of the ODBMS, Operational Database Management Systems web portal. Something really interesting, which I recommend to all of you. So I have put here the links at the end of the presentation. It will be sent to all of you. But without further ado, I would like to invite now Roberto to share with us his excitement in shaping the group and the priorities and the particular approach to shaping the assessment or assessing AI system in practice.
Thank you very much, Stoyan. I'll share my screen.
Yes, please.
So you should see now somehow the big screen. So good morning for those of you who are in Canada and North America. Good afternoon for those of us who are in Europe, and maybe good evening if somebody else is in some other parts of the world. I'm extremely pleased for this invitation that gives me an opportunity to share some of the lessons learned in the last 4.5 years of work for a number of people that I was privileged to coordinate. So we are an initiative, a non-commercial initiative that I've been working for the last 4.5 years in developing a so-called participatory process to help stakeholders to assess trustworthiness of AI system in practice. So since we really want to have a very practical focus, I really would like to focus more on the practical part and keep the theory really short. So my talk is in 3 parts. The first one is a very quick introduction to the so-called EU framework for trustworthy artificial intelligence, because that's the definition of trustworthy AI we've been using it. The second is a quick introduction to the process that we developed called Z inspection. But the main part of the talk is part 3, is an illustration of a real use case that we've been completed in 2021. And I think he will explain more by showing you a real case. So let's start with the first part. We started by considering the work that the EU has done. And the EU obviously is part of a so-called contemporary Western democracy. So that's really the view that the EU is taking. And the essence of modern democracy is based on respect for others, expressed through support for fundamental human rights. So I put it in bold because that's really where all the ethical principle and trustworthiness actually coming from. That's a nice quote from a professor of justice in Oxford. So we use the so-called guidelines for trustworthy AI, is a EU framework, and it was set up by the EU for defining guidelines. It was so-called high-level expert group that gave this definition. It was published in April 2019. So when we started, that was not already published, but they were drafted around. And these are guidelines. So this is not a law, guidelines. And for this framework, trustworthy AI has 3 pillars. It should be lawful, respecting all ethical laws and regulation. There is no specific law on AI, although in Europe there is work on that. It should be ethical, respecting ethical principle and value, and the question would be which principle and which values. And it should be robust. And here they take robustness in a much broader sense, is not only the technical perspective, but also taking into account the social environment. Now, from fundamental human rights, they derive ethical principle 4. The first 3, you probably will account, because respect for human autonomy, prevention of harm, and fairness, you've seen them already in medicine and bioethics. They invented a 4th one called explicability. This is not a typos, it's a new word they created in order to express some difficulty in explaining or transparency. So here, 4 ethical principle. As we know, ethical principle might have tension between them, but the ethical principle will not help you to make an assessment, to give you a guideline. So in order to try to make a step further, they define requirements. Already the word requirement sounds engineering, although it's not really engineering, but they try from these 4 ethical principles to define 7 requirements. Each requirement has sub-requirements. The 7 requirements are the following. And by the way, this is the paper that they published in April 2019, is human agency and oversight. And interesting, as a side note, they also suggest that in some cases it's important to do a fundamental rights assessment. So they just put it like a sub-requirement. That's a really big requirement. The second is technical robustness and safety. which is really what the technical people are in understanding. So this includes resilience to attack and security, fallback plan, general safety, accuracy, reliability, and reproducibility. So that's the technical space. Then they have something called privacy and data governance, which really includes privacy, quality of integrity of data, and access to data. Nothing really new, especially in Europe, where we already have a law, GDPR, regulating data. And here it gets interesting because the fourth requirement is called transparency, and it really comes from this new ethical principle of explicability, and it really includes things such as traceability, explainability, and communication. The last three are diversity, non-discrimination, fairness. And bear with me, they do not make a definition of what fairness is. So these requirements are left very general and not even domain specific. And you might imagine, how many definitions of fairness you can choose and at which level. You can start from philosophy, or you can start from machine learning, or you can start from the domain. So this is these are very general requirements, and the sub-requirements are hopefully including avoidance of unfair bias and stakeholder participation. The sixth requirement is really difficult to measure, is societal environmental well-being. And you can see from the sub-requirements here include sustainability, environmental friendliness, social impact, and then two big keywords, society and democracy. I found it quite interesting that they put such a big keyword like democracy as a sub-requirement, but that's how they define it. For me, it would have been on top of the requirement. So if an AI system is endangering democracy or society at large. And the last one is accountability, which really is the link to the legal part, because these are not legal requirements. It is not a law, but obviously accountability is a requirement that is important. Whenever something goes wrong, you need to find out responsibility, and accountability is a requirement. It includes things such as auditability in case you will need to do an audit, trade-off, which will be very much the case, because most of the time there is no one solution. And if something goes wrong, the ability to so-called redress, so undo certain action if the system was already deployed. Now, they would like to have this being used in all the life cycle of AI systems, so from early development to deployment and monitoring. And this is basically what we have. Is that, on paper, they also have a checklist and a web tool that asks you a couple of questions related to each of the requirements. You give answer, and they give you a score. And a couple of things here. First of all, is a static checklist. Number two is not domain specific. Number three, nobody validates your answer, so you can answer whatever you like. And especially these guidelines, although they are quite useful, they do not really anchor in the context of the application. So, fairness, well-being, they're completely different if you are in a hospital, or if you are in a bank, or if you are a government. So this is really where it is difficult from these guidelines to try to do something in practice, especially when we started to work. So how do we assess trustworthy AI in practice? So that's the second part. I'm privileged to lead the team of international experts, so research and professional, not commercial, and we created a so-called participatory process to help stakeholders to assess the ethical, technical, domain-specific, and legal implication of the use of an AI system within a given context. The work that we are showing is under Common Creative for non-commercial use, and the name is protected to avoid the people using properly. But other than that, the initiative is non-commercial. So we're practitioners. So like what Stoyan was saying, this is really where we are. We are taking good words and good guidelines and try to see what it means when you really assess something in real, but not academic cases. So we've been assessing 4 cases in healthcare, as you can see, spanning from 2019 up to one that we finished in December 2021. I will be showing in particular this case, and all of these cases in green are assessment of system that was already implemented and deployed, but we also did the co-design together with engineers. In particular, here was a co-design with engineers developing a deep learning solution for detecting skin cancer. Here we had worked together with a hospital in northern Italy where they deploy an AI system in radiology at time of COVID, when the peak was there, helping radiologists to detect lung compromise of COVID patients. This is a case that I will talk to you later, and here we've been analyzing the AI system for predicting cardiovascular risk. Recently, we've been working in another domain. I'll show you at the very end. But now in practice, we do not use checklists, but we use an holistic approach. So checklists could be useful, tools can be useful, but we try to really involve as many as possible stakeholders as it is possible in any stage of the AI life cycle. That means that the first thing first is to define a so-called interdisciplinary team of experts. Now, this is not general. It really depends on the case, on the domain, on the complexity of the use case, but it has a big implication on the assessment because the selecting experts has a big implication on the outcome of that. Now, we did some, we actually published some kind of lesson learned on that. Basically, our process can be used in various ways. It can be used in early design. It can be used in development. It can be used for assessing something already deployed, but in particular, it can also be used for monitoring a system that is being deployed, evolving over time. This part here, the monitoring, is seldom mentioned. Most of the people tend to focus on certification or try to give labeling or score. But as I always saying to people, an AI system is not a fridge that you put the stamp, energy consumption when you sell it, but then nobody comes into your home after 3 weeks or 6 months to figure it out if the fridge is really consuming what the label says. Somehow it's more like a car. As you see, in cars are reputed as more dangerous than the fridge. So you have to bring a car for inspection. But then somebody has decided, okay, when do you bring the car? Every 2 years? Why not every 3 years? Or why not every 6 months? And what do you want to assess? Well, the brakes, the lights, anything that was deemed to be considered important, but nobody's going to check the driver after you verify your car. Nobody's going to check the state of the road. Nobody's looking at the society around it. So you can have a perfectly checked car in the hands of a perfectly unsafe infrastructure or driver. So, and on top of that, AI is bringing a completely different dimension because most of the time you cannot explain the internal. So the way we work is basically we say, okay, we don't want to use a checklist because a checklist is already forcing people to think in requirements. We would like to have this team of interdisciplinary people, selected, carefully selected, to talk about this system. But in order to talk about the system, you have to understand the context. So we use social technical scenarios that are well known in order to collect as much as possible information for what is the aim of the system or the systems, who are the actors, and various level of actors, expectation, interaction, worries. What are the processes where the AI system is used? Very important. What technology and context this AI system are used, and how AI systems are influencing decision, if ever, within these processes. And the boundary of what you want to assess is also a very key thing that needs to be addressed upfront, because you never assess only a software, you assess the entire ecosystem. But at a certain point, it has to be clear what are the boundaries. Otherwise, you're going to end up assessing an entire hospital or an entire government, and that's not necessarily what you want. But doing that, experts of different disciplines, they normally speak different languages. They look at issues that could be relevant to be addressed. Sometimes it might be necessary, especially in government, to perform a fundamental rights assessment. We did it actually in the last pilot project that we did it with the Ministry of Interior in the Netherlands. And in the Netherlands, the government is recommending to use a so-called fundamental rights and algorithm impact assessment, which is quite useful for starting the discussion whether the AI system that you are using in the government is infringing fundamental human rights or not. Now, the question is your AI system infringing fundamental human rights, which is one of the questions they have? They don't have a way to answer that. So we've been working in combining our process in order to give some process to address that. They have actually cluster of fundamental rights, which we found it quite useful. The cluster in fundamental rights related to people, freedom-related fundamental rights, equality rights, and procedural fundamental rights when something goes wrong. There's a link here to the appropriate document. No matter whether you use a fundamental human rights assessment or not, if you want to really assess if the use of this AI system is trustworthy within the context, we need to start developing evidence base. Now, an evidence base is supposed to give strong evidence to a claim. And if you have that, you can then identify tension. Now, this is really, on paper, easy, but in reality, how you do it. So the way we do it, we look at the socio-technical scenario, and it's particularly if the system has already been implemented, we look at anything that looks like a claim. And a claim is, there's something called claim arguments and evidence, which is a well-known framework, not using AI, but using some other technologies like nuclear technology, where they basically simply say, well, a claim is an assertion, they need some supporting evidence. Until there is no evidence, it's just an assumption. For us, an assumption is a possible risk. So basically with this idea that you need to provide evidence to a claim, and then you also have to give specific source of evidence. Now, specific source of evidence really depends on the domain. For example, in medicine, you could say, well, there's a clinical trial, it's a peer-reviewed journal. But when you start going to other domains, then the expert need to be in agreement of what is a source of evidence. And source of evidence might change over time, and there might be contradictory source of evidence because there might be different viewpoints. So that's one of the important lessons learned. So you could have arguments, pro and cons, and you might even end up having experts within your team that have different opinion and supply different evidence. And at the end, there is not one solution, there is a tension. Now, identify tension and trade-off is actually what the EU guidelines recommend. So tension might arise between ethical principles, but we discovered that there are also tension arising between various experts giving evidence. Now, they simply say, well, in line with our EU fundamental commitment to democracy, this tension should be made visible. But before making visible, you need to figure it out what kind of tension we have. So, experience we have made is if you work with a team, and the team is composed of engineers, for example, machine learning engineers, plus domain experts, plus applied ethicists, plus legal scholar, some of the people in the team have absolutely no idea about what an ethical tension is because they didn't learn it. That's not in their curricula. So when you say, okay, identify an ethical tension, they're left in some kind of vacuum. So we figured it out, well, why don't we help them? So we found a very nice paper from the Nothing Foundation, 2019. They were giving guidelines for research. So nothing practical, but they were suggesting some possible tensions. So we said, okay, what are these tensions? Well, very important. We are not talking about high-level principle. We are really talking about tension, meaning different values within this use case, so within this technological application. And this is really an important lesson learned, because when you have people that are not focused on the use case, they might end up talking about tension or theory that are in general, but they have nothing to do with the case at hand. That's also important to choose the right people that have theory, but they also like to apply to the practical part. So having said that, so we found it very useful to provide a catalog of samples of tension taken from this paper to our teams. Now, as you can see, there's quite of them. For an engineer, I mean, people that have not really an ethical education, they might understand accuracy versus fairness. But already when you start having a tension like personalization versus solidarity, or convenience versus dignity, they might be lost because they have no idea of what we talk. And we don't want feelings. We want to have clear definition of the terms, if possible. So we give them a catalog, we give them a descriptive part. Sometimes it's not enough, so we give them examples so they can then see whether the case that they are evaluating is similar. If that's the case, I could say, well, in this case, we think there is an issue between privacy and transparency, but it could also be that they don't find anything in this catalog, and then they need to kind of find new tension. And we found also a way of giving them some guidelines. So until now, we've been having a number of people working in an open vocabulary, so discussing completely freely, bringing their own expertise, but not necessarily focusing on the requirement of trustworthiness. And that's done on purpose. So that's the difference with the checklist. So then when we are reaching a level where some claims remain assumptions, so they become possible risk, and they might be described by a legal scholar, different than a medical doctor, different from a machine learning engineer, or different from the perspective of an applied ethicist. The key of our process is to map these issues, whatever framework of ethical or trustworthiness that you want to choose. Now, we are choosing the EU framework for trustworthy AI, so we map it to the 4 ethical principles and some of the 7 requirements. But in reality, our system, our process can be used in different geographies. For example, you would like to use the UN framework for ethical, the OECD one, or whatever, if you don't feel confident with the one of the EU. And this is really an advantage that we discover, because then you can map it to a close vocabulary that disagree upon the context. And then you rank this issue. So, for example, you could say, well, in this particular case, it's very important an issue in transparency and fairness and accountability, and you rank them by relevance. We're not a certification body. We don't give any score. We don't give any stamp. We simply give recommendation. helping stakeholders then to make decisions. Recommendation could be, well, is appropriate to use, or we identify risk and we recommend ways to mitigate those whenever possible, or we identify issues that are so severe that you might want to redress. So I make it very short because then you say, all right, this is a process, but what does it mean in practice? So Stoyan was about who cares? Well, you should care. And I give you an example, a real example, not an academic example. It's a 6-month assessment. It's called self-assessment because we did it together with the key stakeholders. The title is called Assessing Trustworthy AI, Machine Learning a Supported Tool to Recognize Cardiac Arrest. It was done together with the so-called Emergency Medical Dispatch Center of the city of Copenhagen that is handling, okay, and this is the team, big team. But before that, I want to say is handling emergency calls. So as related emergency call in Europe, 112, in the United States, 911, in South Korea is 991. But anyway, they're normally a service that is actually managed by, at least in Denmark, by a set of hospital under the umbrella called Emergency Medical Dispatch Center. And they're basically helping any call that has to do with emergency healthcare. So we created a team. As you can see, this is what we call middle size. So you see, this is about 25 people. Just to give a feeling, you go from applied ethicists to medical doctors, different kinds of medical doctors, legal scholar, other medical doctors, technical people, and domain specific. So the way you assemble it is a craft. There is no formula, but that's very important because it really depends on the case. So what is normally the case? You know, a 112, somebody calls 112 and is actually triaged by a medical dispatcher. They receive the call. They're normally medical trained people. And then they send maybe an ambulance if they understand is the case. So this is basically what you've seen on the street. So what was the problem? So this is what the social technical scenario was about. I'm trying to give you results and also give you some hints on the process. So the problem was in the last years, this Emergency Medical Dispatch Center of the city of Copenhagen has failed to identify approximately 25% of cases of so-called out-of-hospital cardiac arrest. The last quarter has only been recognized once a paramedic ambulance arrived at the scene. Now, when you read this and you're not a medical doctor, you have absolutely no idea what is a cardiac arrest or what is the difference between a cardiac arrest and a heart attack and what does it mean out of the hospital. So you need to have some kind of explanation. So a cardiac arrest is not a heart attack. And to make it simple, a heart attack is a circulation problem. The person who has a heart attack is still able to talk, although is in major pain. A cardiac arrest is an electrical problem, and the heart is not working anymore. The person is totally unconscious, so is almost dead. That makes a big difference because when somebody is calling, it's not the person who has a cardiac arrest because obviously he cannot call. So somebody on the phone should call and try to explain to somebody else, the dispatcher, that there is a person unconscious in the house. Now, what is the issue here? If this case, and not necessarily a case of cardiac arrest, but if this is a case of a cardiac arrest, the person on the phone should be able to understand by asking specific questions. If there is a cardiac arrest, he can instruct the person that is calling, the so-called bystander, to do a so-called cardiopulmonary resuscitation or CPR. Also here, you need to explain people what CPR is, because if you're not a medical doctor, maybe you know about it, but you don't necessarily are supposed to know. But CPR, and I'll show you afterward what it is a precondition for trying to reanimate the person. And it has to be done very, very fast, within the next 1 or 2 minutes. If you wait too long and the ambulance is arriving 10 minutes late, maybe the brain is damaged and the guy is bad or severely damaged. So here is the CPR, and the example is 911, so in the United States. Here's a situation, somebody is unconscious. The bystander is in panic, he's called 911, 112. If the person, the dispatcher, asking specific questions that are actually defined in the protocol, because he has certain questions he has to ask as a protocol, understand, for example, by saying, please check the briefing of this person. And he understands that this could be a case of a cardiac arrest, is instructing the bystander to do a CPR. So place your hands at the center of the chest, push hard and fast, about 5 per second, and do it a number of times until hopefully the person reanimates and maybe start talking. So there's initial liability here, because who is responsible if something goes wrong? Well, the medical dispatchers are liable. Well, they're not liable because the person might die, but they might be liable if they did not follow the protocol. For example, they didn't ask the right question in the protocol. They were not asking any question at all. They were doing something else while the call was around, and were maybe watching a movie on the phone. So that's liability. So very serious, and they are under time pressure. So until now, no AI. Now it comes to AI. So the team of medical doctors, please bear with me, medical doctors, not engineers, but not even ethicists, decided that they wanted to improve. So they wanted to have a solution for improving this situation. Because 25% of cases that are not recognized potentially means 25% cases of people that might die. So they're owning all these audio files of calls. And they basically commissioned to a startup of the University of Copenhagen, or PhD, to create a machine learning framework that could listen to this call and by the pattern of conversation, alert, like in Alexa box, if there was a high probability that this conversation was basically talking about a possible cardiac arrest. So listening to the call and alerting. Then we came to the in the picture, because the medical doctor said, well, let's do an assessment together with us. So we bring a neutral set of experts, all pro bono, by the way, so there were no conflict of interest. And we try to understand, but is the use of this AI system trustworthy? So that's basically the question that Stoyan was asking before. And why do we want to care? So this is the context and the process where the AI system is used. This is the person who's unconscious. This is a bystander. He's calling 112. The call is received by a dispatcher who has a display. Here, now, all of a sudden, you have like an Alexa box that is listening to this conversation that is happening between this person, the bystander, and the dispatcher, back and forth. This is only 0 and 1. Questions such as noise, want to have noise, not having noise. These are all design decisions that have very relevant implications. But basically, to make it simple, you digitalize the files, and this AI is blinking, alerting, while the two talk if there is a high probability that a conversation is representing a cardiac arrest. Now, here is the interesting situation here. In the ideal case, the dispatcher will thank the AI and instruct this person to do a CPR, and everybody would be happy because then this machine has helped this person to make a good decision, and this one has saved a life of a person. So that's the ideal scenario that was in the aim of this system. What about evidence? Now, the claim is this is useful. It's helping detecting cardiac arrest. Question would be if it's actually more accurate than the dispatcher. That would be the first question. And second, is it doing some mistakes sometimes? So basically, we look at evidence. So the medical doctors, in this case, is a good job because before trying to use this system, they did a study. So they first did a so-called retrospective study. In medicine, it's well known, but again, if you're not really in that field, a retrospective study means that you take, like in this case, 108,000 emergency calls audio files in a particular year that the medical doctors owned. So they was lucky. So they owned that data. And they knew also the results. So let's say about 108,000, there were a number of cases where there was cardiac arrest. And they knew exactly which of this conversation was leading to a cardiac arrest. The AI system was tested in laboratory, analyzing this audio file, and it performed quite well. In fact, it was faster than the people to recognize a possible cardiac arrest. It was very accurate, but he has a little glitch that sometimes he was thinking there were too many false positives. But anyway, so the summary of this, and it was actually published, so this is why it's an evidence that has some meaning because the peer review, it seems that the AI system in vacuum is performing well, faster than people, so he might actually inform the dispatcher there is a case, and that could be good. We look at some other evidence, and again, this is a very nice case because the medical doctors did another trial. This time they did the randomized clinical trial. Now, in differences with the previous one, in 2020, they look at 5,242 emergency calls, real, and they split two groups. One group with the machine learning tool between the dispatcher and the bystander, and another group that has the traditional bystander and dispatcher, but no AI, and compare if there was any improvement in the group that had the AI as a supporting tool. It was published. So again, peer review, so it sounds actually reasonable. Interesting surprise, there was not significant improvement in recognition of out-of-hospital cardiac arrest during calls in which the model alerted dispatcher versus those in which it didn't. Although the machine learning had a higher sensitivity than the dispatcher. So here is an interesting situation now. You have two evidence. One is saying without people, the AI is doing pretty well. The second says when it starts being used with people, it doesn't seem to be doing any good. The interesting question is it also doing some harm? So now think of you as a head of the emergency medical system in Copenhagen. You've seen these two evidence and you have to make a decision. Your engineers and your doctor said, well, let's use it. And you look at this and you have to make a decision. How you make a decision? You have no information whatsoever and you do a decision. That's what happened in 99% of the cases where people have to make a decision, but there's not really an evidence, there is not a process for helping those people to understand if there are any risks. So in fact, what happened, the system was put in production in the fall of 2020. That means that the head of the medical dispatch center authorized the use of the AI system because likely he has informally make this assumption. All right, the system doesn't seem to be helping. but maybe it will help, and it doesn't seem to be doing any harm. No proof, no evidence, only assumptions. You're taking a risk. You put in the system in real life, because this is a real system. It's not like in the laboratory where you are experimenting. Somebody calls and there are people's life at stake, and now you have an AI system. Here it is. This is the dispatcher. That's our AI system. And this is what it is. Of course, you can send an helicopter, you can send an ambulance. So, and now I'm trying to guide you through the results by showing the process. Obviously, when we look at that, we say, wow, the attention in the evidence base. Obviously, there is a tension between the conclusion from the retrospective study that says that the machine learning performed better than the medical dispatcher. But then when you look at the randomized clinical trial, it didn't show any benefit in that particular situation. Of course, this is just a trial. It is very much influenced by who were the group of people, how the communication was done, what kind of information they have, what kind of motivation they have. But nevertheless, the results was that there was no improvement. So then you start thinking, okay, we're talking about trustworthy AI. It's interesting, they don't say ethical AI, they said trustworthy AI. So trust is the key, but trust is very difficult to define. There is nothing that you can define in mathematical terms, but obviously here there seems to be a possible lack of trust. So in our assessment, when we did the social technical scenario and analyzed those, it was important to try to understand whether this AI system was influencing the interaction between human actors, and if yes, how? And of course, you can have lots of ideas, how it influences the conversation. But at the end of the day, in the clinical trial, it didn't work out. So then you have to basically, while you're discussing, you have a bunch of people with different background, they try out certain hypotheses. The dispatcher possibly did not trust the cardiac arrest alert. It might depend on how the system was introduced, how the well-known cognitive bias were presented. If the user system was labeled as a learning opportunity, or it was a threat, or it was simply that the dispatcher were not really capable of understanding this technology. Or it could be that the dispatcher simply didn't pay sufficient attention to the output of the machine because they were very stressed and they're liable of any mistake. And this, you start relating to some requirements, which is really human agency and oversight. Now you have a discussion which is open vocabulary, but then you start saying, well, we are talking about an AI system that is not making a decision, but is influencing the decision, and humans are in the loop. But how? How they are in the loop? Still no answer. Then you start looking, but whoa, wait a second, it's not helping, but what about risk? What about possible harm? And then you start thinking, well, if you are in machine learning, you start thinking false positive and false negatives. I'm coming to that because that's really important. One of the biggest risks for a use case like this one here is where a correct dispatcher, so a human being who has been trained and he knows exactly how to do his job, would be overruled by an incorrect machine. Now, the machine is not really calling the ambulance. So overruled means that it's so much influence that at the end, even if it thinks there is a cardiac arrest and the machine, for example, does not think about it, it's doing nothing. That would be the worst. The other way around is also interesting because it might be that the AI is signaling a cardiac arrest and there is none, and then you send an ambulance, when in reality there is no, or you're asking to do a CPR to somebody that is not in need. Now, by digging into the social technical scenario, you start asking questions. Then you ask, in one of the workshops, we asked the medical doctors, but how you design the system? And the medical doctor said, well, for us, it was extremely important not to have false negative, meaning very accurate. Unfortunately, as a rule, this system has more false positive than the human being. That's the consequence of that decision. Because the medical doctor thought, well, if the AI is very accurate, it will detect every single possible case of cardiac arrest. And it might be that in some cases, blinking when it's not necessary. That's a design decision. So it was embedded there. It was not communicated to anybody. But that has a major implication. And this is really something that is a major design decision that we take as a claim. Because really, I mean, technically speaking, here you have to see with whom you talk. If you talk to a machine learning engineer, they want to see something like sensitivity and specificity. But at the end of the day, it doesn't matter. If specificity is too low, meaning that the AI system is alerting even when it's not necessary, so it's a false positive. CPR is starting on people who don't need it. Now, if you start pushing on the cage of somebody that does not has a cardiac arrest, at worst, you can break the cage. Now, it's interesting because this is a case in Europe. And medical doctor said, well, not big deal, because very likely the patient will react because he has no cardiac arrest and will fight back. In the worst case, you rip the cage. Now, I did this presentation in another geography that is not Europe, and somebody said, well, but in the United States, a lawyer will already sue you because you ripped the cage. Very important context situation on what are the responsibility of those people. Because this is really an important thing. The assumption made by the doctors here has an implication. Now, I'll come to that because now we're closing the loop. The system is a black box. Because it's not open source, you don't see the model. You know the input because the audio files are the one that owned by the medical doctors, and you know the output. But the inside, you have no idea. So there is a lack of explainability. The system is not transparent. So it's blinking or it's not blinking. That's all. You cannot ask the AI system, excuse me, why you're not blinking or why you're blinking. Another design decision that is quite important, and it has to do with diversity, non-discrimination, fairness, and possible bias and lack of fairness. It was reported in one of the workshops where we talk about that with the medical doctors, that they discovered that the first version of the AI system was not working very well. If somebody was calling, but it was calling in a car with noise, or there was noise, like a bus passing by, a dog barking, and the system had too many false negatives. So they decided, again, decision, not communicated to anybody, to remove all noise. But that includes removing also the way the patient was breathing. Because, when you have a cardiac arrest, apparently, and that's why you need to ask the medical doctors, somebody who's having a cardiac arrest has a very specific sound that if you hear it, you can identify that this is a cardiac arrest. It was taken away. So, but one thing that they actually didn't think about it, which is extremely interesting, is the system was trained mainly on people speaking Danish. Now, if you speak Danish with a heavy dialect, because in Denmark there are different dialects, or if you speak Danish but you're not mother language Danish, so you have an accent, or you actually speak another language like called in English, the system is not very accurate. They didn't think about it. So now you have a system in production in the city of Copenhagen, which is quite an international city. You call 112, and if you speak the wrong language or you speak in the wrong way, the AI is not accurate. But what does it mean it's not accurate? It might not understand that there is a cardiac arrest, so it's not blinking. Now you have an interesting situation. You have a dispatcher that is very, very experienced, maybe, or maybe not. They now have a machine that doesn't do anything. Now you have an interesting situation because either the dispatcher does not trust the machine, so he will not care even when the machine is right, or if he cares and the machine is silent, and there's a bias in the training data, like this is the case, there might be a case where somebody is speaking in a different way that the machine is trained and the machine is not reacting. You can imagine the consequences. See, now you start digging. And so the technical people of the assessment started to look at the data sets being used for training this system. And they discovered that the system was tested with data from calls between September 1st, 2018 and December 31st, 2019. And it appears to be biased towards older males with no data on race and ethnicity. Now, this is, again, something that in the assessment starts saying, okay, is any correlation between age? The cardiac arrest happening the older people? What about difference between sex? And there was no information on race and ethnicity. Interesting, because the heart is different by race. This is something you discover by having evidence. So when you have a discussion like this, and this is left, unclear. And then there's a big question on liability, because at the end of the day, no matter what happened, their only responsibility is on dispatcher, not on the AI vendor, not even on the medical doctor that decided to use AI. If the dispatcher is sleeping or is not asking proper question, is liable. If you're asking the proper question, he doesn't care about the AI, it's still fine. So then you're thinking, okay, now I have an AI, but ultimately the AI is not part of the process because the liability is all about the person. So this is an important question because, what is the conflict? Because refusing or accepting an alert is very central on responsibility if something goes wrong. De-skilling. This system, as every system, I would say, has a risk of de-skilling. So that's what we identify. Why? Because suppose I have a young dispatcher that is not really big of experience. He's been sold a machine that is supposed to help him on doing that. So every time the machine is blinking, he's happy, but then he's not really learning, or he might even unlearn because he's still relying too much on the machine. It might be more convenient. Well, the machine was blinking and I sent an ambulance or I did CPR. But it could be the other way around. It could be so-called risk of alert fatigue. And the term alert fatigue describes that you have a busy worker, especially in healthcare, and something happened that is disturbing you and is always wrong. It's like, the AI system is blinking 10 times and 9 times out of 10, they are false positive, is ignoring this. And so this decision of low sensitivity, which was a design decision, might lead to alert fatigue, and in turn, ignoring true alerts. And that is back to the issue of trust. You see, now you're starting putting things together. Then we look at the legal framework. GDPR is the only thing that is legal there. And then you have specific regulation in medicine. At that time, there were not specific regulations. So this AI system was classified as level 1 in the EU classification for medical devices. That means, they didn't have to do any particular test. And then we look at society environmental well-being, which is very difficult. In this case, we say, well, there could be a broader implication because there could be additional costs that could arise from an increase in false positive by this system, resulting in unnecessary call taker assisted CPR with some damage, maybe rib cage, and dispatching ambulances when they are not necessarily, and trade-off by detracting resources from other areas. Now, difficult to measure it. Now, this is the overall general now, and that was the first phase. The second phase, and I'm about to finish, so then we have time for discussion. How do we map all of these nice things into the framework? Well, we use templates. So we force people with different background to describe the issue that has no evidence or is a risky one in the ethical principle and the requirement. And here you go. So you have an ID ethical issue, for example, E5, you give them a name, potential harm resulting from tool performance. Small description. The tool characteristic performance, such as higher rate of false positive compared to human dispatcher, could adversely affect health outcome from patient. This is still very general. Now you are mapping, and you have what we call mappers, a subset of our experts. They need to take this description and map it to what ethical value and what requirements. So in this case, and as a close vocabulary, you map it to prevention of harm. And what you need to look at, requirements such as technical robustness, safety, accuracy. So you say, well, you have an issue here. You have an issue in prevention of harm, and you have to look at accuracy because your decision there has a risk. And then if you want, you have a narrative response, which explain more in detail exactly what I've been explaining to you before about false positive and false negative. So you can publish that, you can express it to other stakeholders. But you see, you have at least now a common vocabulary. Then it could be that in some cases, you end up having a tension. And we have a classification of tension, true dilemma, false dilemma. Here is a typical example. So you give a name to the tension, you give a label, you say what kind of tension, in this case, the true dilemma, so in the ethical sense, and the trade-off. What is the trade-off you can offer to the stakeholders? Fairness versus accuracy. And then you have a little description. The algorithm is accurate on average, speaking Danish, but might systematically discriminate against specific minority or callers and or dispatcher due to ethnical and gender bias in training data. So we're not saying this is good or bad, we're saying this is basically a trade-off, there's no solution. And here we are, we present you that, and they didn't even think about it. So then we give recommendation to stakeholders. The output of our assessment is not a label, a certification, or a grant, you good or bad, is a bunch of recommendations based upon all of this work that hopefully help people, stakeholders, to do better decisions. And depending if you are in design or if you are already in implementation, then you can take action. I just show you one recommendation, just that you have a feeling of what we are recommending. And we have a paper with all the recommendations. So we gave, I think, 10 recommendations. One was, it is important to ensure that dispatchers understand the model prediction so that it can identify errors and detect biases that could discriminate against certain population. You can stop there, or you can even give some more hint, because there was a black box, so it's a statistical black box. So here, for example, we were suggesting something. At least it should be communicated properly. And then we have some other recommendation, for example, involving stakeholder. When you call, you don't even know there is an AI system listen to your call, and representative or patient were not even involved in this design. So basically, we have a bunch of recommendations. And if you're interested, this is a paper that has been published in July 2021, and you can have a look. And to finish, I just want to say that recently we completed a 6-month pilot project with the Ministry of Interior and the province of Friesland in the Netherlands. And here we use our assessment together with fundamental human rights in biodiversity. So no more in healthcare, but is an AI system used for mapping heathland, grassland by means of satellite images for monitoring nature reserves. Translated into a terminology that everybody understands, we don't want pollution. There's a lot of nitrogen derived by certain sources. If I look at the state of certain grass, unwanted, link it to pollution, I have a feeling of what's going on. Rather than doing manually, I do it now with an AI. So we just finished that. Hopefully we'll be able to publish something. I want to acknowledge publicly that in this 4.5 years, there's been a lot of people that helped me to do this. So this is not my work. This is a collective intelligence, and you can see all these people, this, each of them is a paper and people. So I basically finish here.
Thank you, Roberto.
Thank you.
Thank you very much. We have a number of questions that have accumulated, and I would like to start with one right away. So part of your vision as the part of the Z inspection group and initiative is to foster the adoption of this method, to make it available to people and so on and so on. So the focus on adoption is key. So how difficult, you presented something that looks like a project. Many different people, you needed to study what really happened in there. You provided a case study, and then you started reflecting on applying the principles that you have developed. So if we think contextually, imagine I'm an organization, I'm trying to acquire one system. What's my question? My question is, how does the process, does it look as a project, or it could be more instrumentalized as basic set of principles that I can look at when I look at a particular AI system? And do you have, is it hard to get the data? Everything that you learned, it was a deep engagement with a particular team, knowing exactly what they have done and so on and so on. So what is the spectrum of options that you have to access data that could inform a particular valuable assessment?
Well, that's an excellent question, because this is a process, so it's not a toolkit. So it is basically helping various stakeholders with different expertise to evaluate claims. That's really, if you put it very simple. Now, in order to evaluate a claim, suppose that the claim is technical. This AI system is accurate 90% or 99% of the case, then you need to have somebody in your team that goes deep down using existing tools, accessing data. If you have access to data, you might not have access to any data. And basically with the information that you can, in your best, come up with evidence and arguments. So this could be used in various ways. So suppose that you say, I have an organization, is buying another one, and now I'm acquiring their system, but I have no access to anything. So you use this as a complete black box, Or if it's in design and you have the chance to talk to engineers, you are basically doing a kind of support or trustworthiness design, like co-creation. So it really depends on the phase. So, but it's not a checklist. It would be like, putting people like you who are experts in core value, having some medical doctor or maybe a legal scholar and a machine learning engineer and somebody who has an applied philosopher, observing of all the possible way of using the system within the context. How is it influencing, for example, decision? Is it influencing decision? If yes, what are the issues? And then you start basically making a list of claims, and then you are showing trade-off, tension, and basically you map it to what the EU has asked for guideline. Now, if you have other framework where they're slightly different, you might still map it to maybe there's an issue in fairness, but then you have to be specific and say, what kind of fairness are we talking about here?
Yeah, thank you. So obviously there'll be cases where it is more explanatory in things that were already developed, and there'll be other cases that are more anticipatory, where you'll be talking to people deploying the system and so on. And here is one of the questions.
Exactly.
Here is one of the questions which is related to this, the issue about due diligence. One of the questions is that there is much talk about accountability in AI systems, but actually there is a if you are doing properly the due diligence, then all those things should be covered, in advance. So how does due diligence come into all this discussion about trustworthiness?
Oh, I like that, because before we were defining this process, I gave a series of presentation on the need of an ethical due diligence. Okay, so now here's the situation. At least in Europe, I don't know about Canada, but in Europe, you might be familiar with the European Commission has now a proposed law called EU AI Act. This is a regulation, so it's classifying AI system by risk. It's like a risk pyramid. And for those systems that are statically classified a high risk, like face recognition or something like that, they will enforce conformity assessment and certification, very likely. So this is not yet there, and the conformity assessment should be done by entities that are officially appointed. So it'd be like when you bring your car for inspection. Now, our process can be done before to help stakeholders to figure it out in where they are, or afterwards, but we are not in the business of certifying. But due diligence is exactly similar. So you are doing the due diligence, all is an ethical due diligence. And when you do a due diligence, you might have different reasons for doing that, either because you want to avoid risk, or you want to acquire something, but you want to, before buying, understand if there are any risk, or you might want to do a good job and basically have something that does no harm. So the question is, ethical due diligence is now a law. When it comes to AI regulation, they will force you to do a conformity assessment. And there, I'm not sure they're going to use an holistic approach. I think they're going to use more like a checklist, like when you bring your car, they check probably a bunch of things. You give a score, but then they need to say, well, but what happened afterwards, and this is why the law is. There's been a lot of discussion. I think the US has now come up with some guidelines as well. So it will be extremely interesting to see how this is developing. We are not commercial, so we're not in that business, but certainly there will be a lot of commercial interest as well.
Yeah. So one of the questions refers to the competencies. There is an assessment framework that is to be used by people when they assess the trustworthiness of AI systems. But the assessment activities are always related to a competence framework. So did you have did you think about this type of competencies that people need to develop in order to properly assess trustworthiness?
Yes, and again, we did it as practitioners. So it would be nice to take our lesson learned and turn into something more theoretical that could be explained. So basically, we publish a report for lesson learned, and we learn a couple of things. Number one, how do I create an interdisciplinary team that works? Now, it depends on the case. It depends on the domain. So for example, suppose that you are in healthcare, we understood that domain experts should be of different background. An example in case, we had a case in co-design, by the way, where the system was supposed to have dermatologists detecting skin lesions so that dermatologists could be more secure about what to do. And we had a dermatologist from the team that was developing that, because that engineering dermatology, we brought our own dermatologist, but then we had in our team somebody in so-called evidence-based medicine. Now, bear with me. Evidence-based medicine, until I start working with medical doctor, I didn't even know what it was. But basically, they are very concerned about overdiagnosis. So there was immediately a clash between experts in supporting the claim. And also, interesting, depending on the geography, for example, in Denmark, in Germany, for example, screening is recommended. So every year you might want to do a screening, and is recommended by the government or the ministry. In Denmark, it's the other way around. It's not recommended, because screening leads to more unnecessary operation. You see, then that's the first lesson. So always have some different viewpoints between domain experts. And second, when you are talking about ethics, choose people that are applied ethicists and they're really interested on the case. Otherwise, they're going to start debating about theory, moral theory, theological theory, whatever, but then they don't really care about the case. This is the same for legal people. You can have people that cite you all kinds of law, but there's nothing relevant to the case. So you really need to choose people that are really motivated to work on the case, and each bring his own expertise and stay with their own expertise. Because the worst thing it could be that a machine learning engineer tried to become a philosopher, and a philosopher tried to become a medical doctor. So you need to have, like in due diligence, a clear, this, I think is very similar to due diligence. Only the problem here that you have now a system, most of the time not transparent, that is influencing decision. But due diligence is really all lesson learned in due diligence. They can be reused pretty much, I would say.
Yeah, thank you. So one message for me today was, I think one of the key messages is that, let's not think in a checkbox toolkit way when we speak about such assessment. It requires serious, deep engagement that refers to design thinking approaches, where you really need to get connected to the case, and then in order to be able to apply any principles from one place or another. So I think this is a good lesson. Another question here comes, so with the advancement of more sophisticated AI systems, obviously the ethical concerns will be growing. In a way, we have to realize that actually the advancement of AI systems is putting ethical questions that did not exist before, just because human beings were never able to act in a way that the AI systems could act and make distinctions and so on and so on. The question is, do you see the Z inspection approach evolving, or you see it as a kind of a generic enough to accommodate or incorporate any kind of a new sophistication in the ethical on the ethical dimensions?
Well, thank you. This is a very good question. I certainly see our process fluid and evolving, and this is one of the reasons why we put it under common creative, not for non-commercial. So because it could be tailored for the domain specific, but it could also be tailored to classes of systems. So I would encourage the community, if they're interested, to be in contact with our initiative. And basically, I think every case is a lesson. And then if we are able to learn the knowledge that we have and put it into tools, improvement of the process, I think here we're going to end up having a good way for stakeholders to understand the issues and hopefully making decisions with some better, not making decision because they want to make decision, but because they have went through a process. And if it's democracy, to be transparent, especially for government, that's extremely important, because when the government starts using AI, he also has responsibility with respect to citizens, or you have human rights responsibility, such a good governance. So you go into a space where harming is extremely, always harming is always bad, but I would say that this is a learning exercise, and that's why we have been creating some affiliated labs in various universities or research centers, hopefully in order for them to continue this work with different best practices. And hopefully this becomes a knowledge that can be used, reused, and fine-tuned. Does he answer your question?
Yes. So another question about the case. So I lived in Denmark for 8 years. So, and I have a feeling about Danish language and the issues with Danish language. And in your assessment of the case, you referred that, there could be people that are not well speaking Danish, and there are a lot of those people that do not speak Danish, and then do you see, I see a dilemma here. One of them is that you could develop the system to accommodate more sophisticated dialects and everything, or is it ethical to the Danish people to ask them to develop a good English-speaking, English understanding system? So to see the point that the Danes have done well in their own language, should they be responsible for anyone else that passes through the country or lives for a couple of years?
I think you really got the point, because we are not making a solution for them, but we are sharing with them exactly this dilemma. So before they weren't even aware of. So by being aware, we are not really doing that well to this class of people. And you can say, listen, this is a true dilemma. It's accurate for this class of people, but it might be that there's a risk that if somebody is speaking differently, this system is not helping. Not only that, it might actually damage, because the dispatcher might be inferring. Then this information can be passed to the stakeholder, can be passed to the regulators, can be passed to whoever, can be passed to society. And basically, you could have a discussion how to handle tension. We don't solve it, but we help them to understand them, share it, and hopefully there will be some other context where decisions will be made. We're not making the decision for them.
Yeah. There is a question about dignity. So dignity is at stake from the very beginning, because it refers to asking a system to do something for human beings, and not necessarily much better. So how does the discussion of dignity, did it come often in your experience with cases, in a kind of explicit way?
Yes. For example, in this case, and again, I'm not the expert on applied ethics, so that's why we will need to have this discussion among the subgroup of experts. But for example, when you are treating somebody without the consent and ripping the cage, then you can ask yourself, okay, I'm damaging somebody and it was a false positive. So that's what I meant about the context, because in the United States, if a dispatcher would basically wrongly instruct a bystander to do a CPR to somebody who does not have a cardiac arrest, and this person is not reacting, and the bystander is totally unexperienced, pressing too much and rip the cage, and maybe this patient has severe damage on the lung, it might be sued. Now, in other contexts, I think in Europe, I don't think that we are at that place, but obviously dignity is placing a role, but you need to have people in your team that understand exactly what it means dignity for the case. It's like fairness, right? I mean, you can use a word, fairness, but what does it mean, fairness? What is fair in this case? What is an acceptable definition of fairness at the level of the case? Not at the level of abstract theory of philosophy, but not even in machine learning, you can hundreds of numbers, and they're all in contradiction. So the question would be, what is an acceptable definition of well-being, fairness, dignity that makes sense in this case? So it's very context dependent. That's why you need social scientists as well. You need people that are normally bringing to the team. I'm an engineer myself. I never heard about the word dignity in my study program.
Yeah, and it's not by mistake, by accident that you started when we talk about competencies, the ability to have an interdisciplinary team. If you cover this basis of people deeply engaged, things will come on their own in some way. Yeah. Well, the time advances, and let's have a last question about a little bit on the technical side. So, is there inherent generic tension between the fact that most of the AI systems are non-open source and their trustworthiness and transparency? So do you see this as being always a present Achilles heel of all systems, that very rarely people will make them open source so that they could be more explicable, trustworthy, and so on?
I mean, you ask such an incredibly good question, So, for example, I think that the majority of the system are proprietary, and there's an IP, there's an intellectual property. In intellectual property, I didn't mention it, but intellectual property is a block between, either you sign an NDA, then you cannot publish anything. I made a suggestion some years ago, that 3 years ago, 4 years ago, I was invited to a committee of the Ministry of Interior in Germany. And I think I said, I think the government shouldn't use any proprietary software. I don't think it was really well received, but that's exactly the point. The point is that if you have a company X is bringing to the table a product Y, and you have zero access to the data, to the model, and then you say, please use it, it's hard because, if you're using HR, there's been cases where this was not properly working, and then people react to scandal. So, I mean, I think the best thing would be to have, my understanding is that company that are working with suppliers, they have their own internal benchmark. So they take their product, they use their product on training data that they have, they look at the output, and they decide based upon this trial whether the system that they are evaluating for acquiring is somehow trustworthy in some issues. But this is all proprietary, so they're not going to disclose anything of that. And open source, the question I cannot answer because I think the majority of this product are not open source.
Yeah, so it is there. Yeah, I think the tension will be always there.
Yeah.
Well, thank you very much. It was a well-structured discussion going from the principles to the way of applying it into a real in practice. And I'm glad that our second webinar in this domain is really talking about the practical things. It's easy to get lost into the abstract discussions about many different things, but we're touching on things that are existential. The example that you gave, this is a life-saving department. So those people are dealing with saving lives. And even if it's not in a hospital environment, in another purely a private sector environment, people still they make decisions about investment, about people, about customers in need, about employees that facing them, and so on and so on. So it is a really existential question that many people, and more people, increasingly more people, will be facing every single day. So
I have a proposal. I have a proposal for you, or researcher like you. We give recommendation, but how do we make the case that these recommendations are then used? This is also an open question, because you can give recommendations since there's now a law. So it would be extremely interesting to have research on making recommendation part of a motivational part of the organization, so that at the end they understand that this is, you said, who cares? You know, why should I care?
Well, this is why we got so focused on competencies and using the definition of the European Union, which is skills, knowledge, skills, and attitudes. So if we have to, my opinion is that, and this is what we are trying to do in our program and in our new program on digital transformation and entrepreneurship, we have the evaluation frameworks and the governance frameworks, but we need to relate them to competence frameworks. What do really people do? What are the contexts in which they do it? You know, and these competencies include the attitude, the perspective, the motivation, the the urgency of using those things, and so on and so on. So it might not a kind of a explicit answer, but our direction of attention is now to linking the frameworks to the competencies, and those competencies will definitely go across borders. You know, in your case, you definitely relate to design thinking, in understanding how things happen, how they work, and so on and so on. So, as I said, for me, the key message today is that you're not providing a checkbox thing. You know, let's go and check the attributes of this particular system and get happy about or not happy. Mm-hmm. It's about engaging, looking at the context, seeing who the people are, helping people to appreciate what they're actually doing, and so on and so on. But thank you very much. It is so nice opportunity to get into those issues, and of course we'll keep in touch. As I said, we are reshaping one of our courses to accommodate this approach. We'll also having those issues addressed in our future program.
Well, thank you, and all the organizers for give us the opportunity to share our experience, and it's an open platform of collaboration. So that's very important also to mention.
Thank you very much. Thank you all. I really appreciate. We had 100+ people today from all over the world. This shows who cares. We just cared. We shared our care, and I think this is part of the achievement today. Thank you very much.
Thank you.